Hi, this is COVID again, this time from Hong Kong, and I would like to share the good practices that how actually you can continue to live your life while you are facing COVID, which Hong Kong, I believe, is really strongly proved that is possible. We were one of the first countries hit after China with the COVID virus, and compared to that we started in January, in 2 months' time by now, actually by about 1.5 weeks ago, we didn't really overcome the number of 120 infected people in our country. It was about four people who actually passed away, but the number in that long time does mean that we know something that probably other countries didn't follow or didn't think about or didn't have the information. And I can understand how it feels because we were living through all this certainty with no news, with no research, with an unknown virus and no idea what works, what is not working. But we were so lucky that we were actually living this through in Hong Kong, where people had experience with another coronavirus called SARS. It was 2003, where people lived through a really hard time, and they did adapt a lot of good practices that the moment we had the first SARS cases came out and was working and was helping us to overcome the difficulties, to give us guidelines how to live. It took us really long, foreigners, to pick up all these and to adopt. I have my good reason, having a child with immune issues, to really pick up and take care of these. So we learned how to live and how to practice these on a daily basis. And I would like to share it for the benefit of others, because now we see that that was the thing that kept us clean. As in about 1.5-2 weeks time, we had more and more foreigners returning to Hong Kong who left Hong Kong when the first COVID patients appeared, or the first COVID cases appeared. So they left for knowing themselves to be safe, or they were studying abroad anyway, and now they are coming back, not only bringing the habits from abroad that probably are not supporting our habits, but they are also bringing probably the infection in many cases, which is proven by that just in the last couple of days we had giant increase. From not having any patients, we came to 1 or 2 again, and then we had numbers like 6, 7, and then we had like 3 days ago we've been at 25. Yesterday we've been at 48 new cases reported. So let's see, how did we manage until now? What was the thing that made a difference, and what is the thing that we hope is going to fix again Hong Kong society? 1. No one in and no one out. We learned that we don't let anybody into our little home. We don't let anybody close to our little community who is not practicing the exact same habits that us. And who would be the one who is practicing it? It's only us. So practically nobody can come into our home since the moment we decided. It also means that nobody can leave our home who is not aware or who is not practicing those that we agreed commonly together, who is not practicing it really well. Meaning, if my little girl who is 4 years old can't really take care of her face mask, then she doesn't go out. Then she needs to stay at home. We need to wait for another time to take her, or we just simply don't. That's the case. So let's see what else in there. When we go out, one thing is very important, and the Hong Kongers did stick to it from the first day, which then was followed by so many debates, and is still followed by so many debates as we see the word, whether you wear a mask or whether you don't wear a mask, whether you wear any kind of mask or whether you wear a very special, very high quality, very protective mask, which is like N95, N99, that we also by now have, but we didn't. So the thing is that it doesn't matter. In our understanding, and I think in the bigger understanding, it's more about to protect yourself. The moment you have the mask on your face, then you don't touch. You don't touch your nose, you don't touch your eyes, you don't touch your ear, you don't touch your mouth, which is actually one big opportunity for the virus to go and get you infected, right? So when I'm having the mask, the simple way is that I remember when I'm lifting my hand up that it's not going any further, and I'm not going to do anything close to my face. It's very important that we know how to use the mask, that we don't fix it. We don't go under. We don't pull it down. We don't touch outside, because that's a way that we can further infect ourselves as well. Whether we keep the mask or we throw the mask, we can talk about in another video, but it's really important. So the step one, everybody, before we leave the house, we put a mask on. The other thing, everybody has its own drink, because the moment we are outside, we are not going to get anything. We don't buy drink, we don't eat out, we don't make any temptation come close to us. We limit also who is going out. When we have high numbers, like now we are having high numbers, there is only one person, one designated person who has the access to go. But it's only if it's really something that is urgent or there is no other way to do it. If you can't go around it, like we can't do the online order, or we can't do some that needs to be sorted in the city, then there is the only person who we agreed can go. And that's in this case me. So I'm taking the responsibility, and I need to then behave like I was infected. Then that's my only way to take care of my family, that I'm trying to pretend that I might even have the virus. So that's why it's only one person, that nobody else needs to go through these feelings. But on the other hand, I don't take my phone. Whenever I'm going out, I don't take my phone. The phone can be really dirty. We talk in it, we touch it all the time. So if something, then that's definitely a good source to bring something home. Then there is only avoidance of additional risk. We don't take the children unless the numbers were really low. When we had like one daily 2 cases and they were really far sides of the city, then in our really communities, we did get the luxury to take the children out for hikes, take the children down the beach. They could build castles. Probably they couldn't use the playground at all, but they could still be outside and they enjoy the time, of course with mask and of course following all the regulations that we agreed in our family. But what was very important is that they, no matter what, they had to apply all the rules, like no eating, no drinking, no meeting ups, we always aware that whatever happens, we try to keep distance with others. We don't go closer probably than 1 meter, or if possible, then rather keep the 2-meter distance or even further. No contact sports, no any activities that involves any chance to get too close to another. Then, of course, you also avoid to go out unnecessarily, like going to doctors. So if there is something that we can sort out or we can wait out, then we don't do it. Unless it, of course, if it would be something that could be suspectedly related to the coronavirus, then we would need to make a different decision. But we just try to stay on this side. When I'm going out for shopping, then I'm always walking. I barely take the transport. Well, I did take the transportation when the number of cases were really low, but usually I rather just take the long walk. Could it be 1 hour even, or even more, for getting whatever we need. If we would have a car, which we don't have because our island doesn't allow cars, luckily, then I think we would handle the cars equally like public transport, because with the car, you touch things with your clothes, you bring in, you touch things, you bring in. So it's actually not as pure, not as saline as you expect it to be. We don't use public toilets when we are outside, except when my husband had to go to work, but we don't. And when he went to work, he was really in a special situation. There were too many people looking after them, so there was barely any chance to carry home anything, but he was still really looking after what he's doing and how he's doing, washing hands with soap, closing the top with paper, opening and closing the doors with holding the doorknobs with papers as well. Yeah, if anybody needs more information later on how we do the shopping, then I can probably do another video to include it. Clothing, that's important, because that's what in a way is getting the most dirty in this story. So when we are going out, the first thing we do is the mask. Then I usually put a jacket over myself. That's kind of a feeling of protection, and then I know that I can always just take it off inside out if there is any urgent, but I hope not to have any urgent that would justify that my underclothes can as well be touching anybody. Of course, no phone, like I mentioned before. When I come back, I leave the shoes outside. Very often in places we see that people keep trays with chlorine tablets or Clorox or bleach that keeps the shoes clean. We use spray, but we leave the shoes very strictly outside. I'm stepping over the door by taking my socks off. So practically the moment I'm in the flat, I'm barefoot, and I wish that my foot is probably not having any virus on, which I guess is not. So the clothes I take off inside out. I still have the mask usually. I keep the mask on until I'm done with everything. Then I wash my hand. The clothes I keep in a plastic bag and close it. All the clothes are inside out strictly in plastic bag, closed until they are washed. That's the way we can keep ourselves safe. Then washing hands, taking the mask off. Washing hands, I know there are many practices going on here. 20 seconds could be good. So what my children actually picked up as a practice is to sing happy birthday 2 times. They really love the idea. Sometimes we just pretend to be doctors and wash the hands like doctors do from inside between the fingers, using rubbing the thumb separately, and so on, which takes quite a long time. Once I'm feeling I'm ready and my mask is off after washing hands, then I take a shower. Usually I'm using soap because that's what we were understanding from most of the news by now, that soap has the quality that actually is breaking through the protective layer of the virus, particularly killing it. So we try to be on the safe side, and we also wash the hair. Then for this reason, I actually usually use very light clothing, like sport clothing, because that's easy to wash. I wash it myself very often in really hot water with soap, lots of soap, and I let it soak, and then I wash it a couple of times more to make sure it's nothing carried on. But then it's an easy dry, so next time when I'm going, I just probably pick the same clothes, and then I just wear it outside, and then again it's gonna be an easy dry. Bags. The bags as well are to be washed. So if I'm carrying my bag with me, first I try not to touch anything. If I have a backpack, I don't bend myself, I don't lay to anything. I really try to avoid to any touches with it, but I still clean it up. Usually I just use sponge or something with soap and clean it through, so I have some tools that I already kind of used to having around for these reasons. Home. Yes, act as infected. Yeah, that's my role. Not everybody needs to. If you haven't been out for really long, then you don't. But I don't wear mask, but probably I should now that we have really high numbers and our small communities apparently being hit. In last night we had already most probably quarantine buses taking people away. Then we have a couple of houses that are already signed to be quarantined. As far as I know now it's about 7 houses or 7 buildings. So probably I should now, on going down just with the dog, get the practice of what I'm reading others are doing, that if they are the ones to do the errands, they are the ones who constantly have a mask, or if they have the chance to be infected, then they constantly have a mask even indoors. But otherwise, what is really practical, and it's been always and constantly shared here, is keep the windows open so that the air flow through. It makes the particles not to settle, so it gives a chance to keep your flat probably more clean, as I understand. Close the toilet lids. We didn't understand it. It came through at the very beginning through social media. People were sharing that, all right, so it's again a SARS situation. It's sounding like coronavirus. So so guys, back to the old practices. And one was like, keep the toilet lids closed whenever you are flushing the toilet, so that no droplets are coming or splashing back, which means that actually the coronavirus is already detected in fecalia. It's detected in the pee, so that's a way to stay safe. On the other hand, you also need to pay attention of the U-pipes and every kind of drain that you find in the flat and is probably open, because they have been proven during SARS and now again, through having had infections in buildings coming through these drainages. So these needs to be moist preventing that these very light particles can actually become airborne and infect in different floors, even as we experienced again in two different cases in Hong Kong. Yes, what is most important about home is to really stay alert and aware of each other's needs. So help your partner. Don't leave her alone or him alone. You share the task around the children and household, because there's no way that one is more impacted by this than the other one. Everybody has work to do. Everybody has things to do. Everybody has limits. So patience is a key and very important factor in this situation. Health. Drink. They say, I'm not an expert, but as if I would have at the moment find it on the WHO site, which now seems to be on a safe run, so they don't really share all this information, that drink every 15 minutes. As I understand, keeping your throat moist is preventing the chance that the virus enters through the not moist mucous membrane. The other thing they say is that keep your immune system boosted. So we got instructions from schools to use or eat as much vegetable and fruits, and probably even lower the sugar. We saw the WHO warning it at certain point, warning people at a certain point that try to focus on healthy eating. So probably this is a perfect time, locked up, to change the habits, and let's get started. And try to get the vitamins from natural sources. Self-testing, we got that circulated in several ways from several sources. I would like a doctor to say whether it's all right or not, but we just keep it anyway because we found it to be useful. That we inhale for about 10 minutes or 10 seconds, counting 10, and keep the air inside the lung. But this inhale has to be really, really deep, and whether we can do the 10 seconds can be an indication whether we have a pain, whether we feel like it's causing discomfort or causing anxiety or causing pains that we didn't meet before. Then it can be, as I understand, indicator of a lighter infection, which means then if I would feel that, then probably I would rather take care of myself more, watch my environment, and be more aware, probably even check up with the doctor if I need to, just through a call. Gyulladás csökkentő. Okay, so here it says that there was a news out about that try to avoid ibuprofen because that actually is making, if you're infected, making your infection worse. If you got the coronavirus. Well, I'm not very sure how to handle this information right now, but we just decided to stay on the safe side because I heard that it's not necessarily is accepted, but I understand that the big number of probably the science is still on the side of rather be on the safer side. Try to be as active as you can. So what we do whenever the numbers are low, whenever there are not big jumps, or wherever the infection is not close to us, then we try to take the kids out a couple of times for hiking in a week. But now actually with this number that we had yesterday, 48, and cases in our own area or close by, I think we're just gonna stop it straightforward. Sneeze and cough. Well, everybody is advising to sneeze under the elbow. What we actually use as a practice is to sneeze inside if you don't have anything, because it comes very rapidly, and of course then we shower later on. But what is very important, if you don't feel, just slightly don't feel well, and you might have been out in the past probably even 28 days, because now there's a debate whether they need to consider 28 days, then we try to avoid to be in contact with anybody. We luckily didn't have to think about it yet, but if that would happen, then we would definitely take self-isolation inside the flat, probably take one of the rooms, and we just really don't want to think about the rest. Mental health, yep, often not discussed, but that's an important factor because you're locked up and we are locked up, and it's hard. For us, it's about 2 months. We were lucky for a couple of probably days or weeks. We tried to have regular practices, but now our community decided to be more on the really safe side, finally, of white friends or fellows understanding as well that probably just not going to go away by itself, and probably we need to keep certain habits long and strong enough to get it cleared off from our society. So now I don't think we're gonna do any activities again with children. Anyway, it was very, very considerate. We didn't follow too many activities, but now I think we are really on the very restricted side in every sense. So keep Skyping and keep contact, keep Zooming, keep every chance to discuss and socialize with others, because otherwise it's really heavy. So far, this is what I wanted to say. If you have any questions, then please post. If you have any comments, then please link it under this video. What is really a request here, don't mock my English. This is not the point. Don't think I'm trying to make people panic, because the point is that I'm trying to introduce how you can actually live with it, because you can, right? We proved it. Hong Kong did prove it. But probably our numbers not going to prove it tomorrow, but it's because of there are many people who didn't try, and they were bringing in the bad practices. They went out drinking in bars and, you know, just enjoying life as they wanted, probably having St. Patrick's Days, and spread the virus, not being aware they actually had it, because probably they were not symptomatic. So yeah, well, now it's here, so we're gonna need to fight it again. We are back to zero. Everybody is taking self-isolation. Everybody is taking it very, very serious, as I see now. Even our international community is starting to give a tribute to all those practices that the locals were implementing through these months, and they acknowledge the safety that they lived through these times while Europe got to start the fight, seeing the numbers raising high, or Italy getting the numbers out of hand. And we really feel with you guys, because we had a chance to not live it through. We don't know if we will, we hope not. But these were why we didn't become one of those countries with big numbers, being one of the first one 2 months ago. But it was 2 months really hard work to keep it. So we just hope it's going to be working for everyone. So if you have any comments, you have anything that you notice and you doubt, then it's okay. Just please comment together with the source, because we're still learning, and let's use this chance as a common learning platform. So you see something which is 100% sure, and you see that something I said is incorrect or whatever, then just please comment with the link, the source of the information, with a brief summary to make sure that everybody can just quickly read. Even if they don't read the whole thing, they have the reference, they can, but then they can understand what actually does it refer to. Thank you. Keep yourself safe, and well, we don't have any other choice. We need to bond together. We need to be one. We need to work together. And I think we're going to be managing this. So all the best for all of us. Take care, guys.